Hello everyone, I'm Dr. Fairuz and let's talk everything about psoriasis. Here it is. What is psoriasis? Psoriasis is a chronic immune-mediated skin disorder characterized by sharply demarcated, scaly erythematous plaque, most commonly on the external surface and scalp. Key features: well-demarcated red plaques with silvery white scales, commonly affects an elbow, knee, scalp, and lumbosacral region. Associated with Kovner's phenomenon, lesions at the site of trauma may involve nails, pitting onycholysis, and joints like psoriatic arthritis. So, what are the types? So, this is plaque, gutted, pustular, psoriasis in the scalp, nail, psoriatic erythroderma. This is visual representation. So, basically, plaque psoriasis. It is most common raised and scaly plaque. Gutted psoriasis, it is small drop-like lesion, often post-streptococcal infection in the throat. Like this is gutted. And invert psoriasis, smooth lesion in the skin folds. Pustular psoriasis, like this. Sterile pustules, often on the palm and soles. Here we can see. And erythrodermic psoriasis, generalized erythema, scaling, and systemic illness. Nail psoriasis, this is the nail psoriasis, pitting, ridging, and onycholysis. Basically, what happens in the nail? The rigid and onycholysis occurs in the nail. Why psoriasis happens? So, immune system overreaction. Your body defense system, T cells, get confused and start attacking healthy skin cells. Skin grows too fast. Normally, skin cells take about 28 days to grow and shed. In psoriasis, they grow in just 3 to 5 days, peeling off on the surface. And inflammation. The immune attacks causes redness, swelling, and scaling, and tendency like runs in family, and certain genes like HLA-CW6 make people more prone. Triggers: stress, infection, like sore throat, skin injury, and some medication can set it off. So psoriasis is basically results from abnormal immune activation leading to rapid keratinocyte proliferation and chronic inflammation of the skin. So what's next? Yes, exerting factor of the factors: stress, infection, skin trauma, medication, alcohol and smoking, climate, and hormone change. So, due to stress, it worsens inflammation and flares up. Infection triggers gutted psoriasis, especially the streptococcus infection in the throat. Severe psoriasis may be initial presentation of HIV. Skin trauma causes new lesions like Kovner phenomenon. Medications like lithium, beta blocker, antimalarial worsens the disease, and alcohol and smoking. So it increases severity and reduces treatment response. Climate: cold or dry. So in this climate, it flares and sunlight improves psoriasis. Hormonal changes can trigger or worsen flares. Diagnosis of psoriasis. So basically, clinical features. Diagnosis is mainly clinical based on the appearance of sharply demarcated erythematous plaque with silvery plaque on typical sites like elbow, knee, scalp, and lumbosacral area. So first, to take history, we'll take history and like relapsing codes, family history, triggers, stress, infection, drugs, etc. And then we'll do the examination. Look at the nail changes, pitting onycholysis, arthritis present or not, Kovner phenomenon present or not. We'll see that. And investigation usually not required. Biopsy only if the diagnosis is uncertain. Blood test may be used to rule out mimics or assess systemic involvement. So basically, diagnosis is done clinically. Management. So basically, in management, we do general measures. So patient's education, assurance, avoidance of exhibiting factors like stress, alcohol, smoking, opening drugs, and emollients to reduce the scaling and dryness is used in general measures. And in topical therapy, we use corticosteroid, vitamin D therapy, coal tar, datronol, salicylic acid, and topical retinoids. And we do some additional things like phototherapy, systemic therapy, and spatial situations. So in phototherapy, you use narrowband UVB, PUVA, systemic therapy, we use methotrexate, cyclosporine, acitretin, ballistic anti-TNF, anti-interleukin 17, interleukin 23. And in special situation, we use like in psoriatic arthritis, we refer to rheumatology, and erythrodermic or pustular psoriasis admission is required in severe cases. So in simplified form, first we do diagnosis, then general measures, then topical therapy, then phototherapy, then systemic therapy, and then specialist referral. So that's the simplified form of the flowchart. So that is it for today. Please subscribe to my channel. See you in the next one.